I'm glad you could join us. So we've got a little bit of information on this first slide about the session, and just we're going to do questions at the very end, but feel free to type in the chat as we go. If something comes up, if there's a clarifying question, we can kind of also stop and get that real quick, but we'll also do questions at the end. Make sure you stay muted as we're going throughout the presentation, and just know that if we are asking questions, we'll go ahead and unmute you when the time comes, for sure. So before we really dive into this presentation and what we're going to be answering, I just want to say that why we're doing this. We're really here for you, and we know that, when we have injuries, even hamstring tears, sprained ankles, you're on the sidelines, you're injured, you're not participating, and those can happen for a couple weeks, but when it comes to ACL injuries, those take a lot longer. And so a lot of times, even if you're going through surgery, you'll be out for 6 months, a year before you get back. And we just want to take the time to talk about what do we do to get you back to sport? What do we do injury prevention wise? Why does this happen? So that we can prevent that. You sitting on the sidelines, watching your team playing, wishing that you could play. And coaches and parents, we don't want you to have to see your players sitting on the sidelines, not being able to participate in the sport they love because of an injury like this. And we're going to talk about more of why this type of injury happens, so that we know, okay, how can we prevent it? How can we prevent it from happening again once it's happened? Because there is a pretty large proportion of re-tearing of either the same ACL or the ACL even on the other side once we've had an injury like this. So let's go ahead and get into the information. These are the questions that we're going to be answering during the presentation. What is the ACL and what does it do? How do these injuries happen? Why is there a higher prevalence in females in this adolescent age range? And then what can you do to reduce your injury risk and return to sport following an ACL surgery? Yes. All right, so what is the ACL? ACL stands for anterior cruciate ligament. It's one of many ligaments that stabilize the knee. It's made of 2 bundles that are mostly type 1 collagen, and we'll talk about why that's even important a little bit later. And the ACL provides stability against rotation of the tibia, which is the lower part of the leg going inward. The other attachment site is on the femur, the upper bone of the leg. And then also the tibia shifting forward is another motion that ACL resists. We'll talk a little bit more about this dynamic valgus and what that looks like going forward. So I put a video up for you guys. Before we go on to the next one, let me just flip my screen over to that so you can see it. All right, and we'll play this one for you guys here so you can get a little bit better visual on what the ACL is.
The anterior cruciate ligament, or ACL, is an important structure found deep within the knee joint. As we see here, the ACL is a ligament that connects 2 bones, the thigh bone, or femur, and the shin bone, or tibia. The ACL is made primarily of type 1 collagen, a substance that is found in soft tissues and bones throughout the body. And even though it looks small, it can withstand forces of up to 500 pounds. The ACL's main function is to provide the knee with stability. It does this in 2 ways. First, it helps keep the tibia from moving too far forward on the femur, or over-translating. Second, it keeps the knee stable during rotation. Think of it kind of like the cables on a suspension bridge. It connects the thigh and shin bones, helping to keep them in place and provide support for the knee in moments of stress. There are 2 distinct bundles that make up the ACL, the anteromedial and the posterolateral. Each gets its name from where it inserts on the tibial surface, here and here. Together, these 2 bundles help provide stability for the knee throughout its complete range of motion. To be specific, the posterolateral bundle is more protective when the knee is extended, like this. And as you might have guessed, the anteromedial bundle is tighter when the knee flexes, like this. For more specifics on ACL function during athletic activity, check out our video with pro soccer players.
All right, let me hop back over to our PowerPoint. All right, so that video shows you a little bit better look at where that ACL is, where it is in the knee, and how it stabilizes against those particular motions. So then next we ask, okay, well, how do ACL injuries happen? 2/3 of these injuries are non-contact injuries. That means it's not somebody running into you and causing your knee to go in a particular motion. A lot of times it's the poor mechanics, which is good news in a way because that's something that we can train and work on. Next, the body has two ways of really creating stability against these types of injuries. So active structures are your muscles, and that's what's going to prevent a lot of stress on the ACL. Then when the muscles aren't necessarily doing what they need to be doing, and we'll get into that in more detail, then the ligaments have too much stress on them. And we saw that the ACL can handle quite a bit of stress, but when the muscles aren't doing what they need to do to properly function and our mechanics are not adequate, we get these dynamic knee valgus happening, that rotation inward of the tibia, and those motions aren't controlled. That's when we get issues with the ACL. So we got one more video here before we go on. Let me switch screens again for you. And I'll share this video again. So here's a look at what the ACL is doing while you're actually moving and the motions that it resists.
That's how the ACL functions when you run. When your leg is on the ground and you're bearing weight, the tibia moves forward on the femur, then returns back to neutral when your leg is off the ground. An intact ACL will help keep the forward shift of the tibia in check during your stride. When your ACL is injured, the tibia will move too far forward, which puts stress on the secondary stabilizers of the knee. When you're cutting or pivoting, you're often planting your lead foot hard on the ground, stopping abruptly, and then propelling yourself in another direction. When you plant your foot, three large forces are introduced on your ACL. These are internal rotation, dynamic valgus, and anterior translation. If your muscles are weak or your technique is poor, these same forces can cause an ACL injury. When training, focus on building strength in your core and leg muscles and developing a sound sense of body control.
All right, and we'll go back to our other screen. All right, so that gives you a look at kind of what happens when you're running, when you're cutting in terms of that ACL and why those movements create that stress on the ACL. So we'll talk about our local muscular factors. When those muscle factors aren't working properly or aren't balanced, that's when we start getting more stress in the structures. So we've got the quadriceps that are in the front of the leg, in that thigh, and then you've got the hamstrings that are in the backward part, in the back of the thigh. So if we don't have good balance between these muscles, say the quadriceps is pulling too hard, that creates that forward translation or that shift on the lower leg that causes more stress on the ACL. So there really needs to be a balance between using the quadriceps and using the hamstrings, because the hamstrings will pull backward and resist that forward translation. And so also when it comes to movement mechanics, that can help dictate whether you're using more of your quads or whether you're using more of your hamstrings and the muscles in the back of the thigh. So on the left, we see an example of mechanics that aren't great. The knees are going really far forward compared to where the feet are. And so that's a strategy that will actually increase activation of the quadricep muscle and put a little bit more stress on that ACL versus the one that we see on the right. So that's just an example of how your movements can dictate what muscles are working more and how that increases the stress on that ligament. Next, looking a little bit further away from the knee, because a lot of times we focus so much on the knee itself, but it's important to keep in mind that even core strength and stability and trunk control can have an impact on that ACL. So on the pictures we see over on the left, we've got the trunk going one direction, the knee going the other direction. Especially in this lower example, it's a little bit small, but this was taken in a lab with videos and force plates, so we can really see where the forces are going on the knee. And we can see that the knee falls a little bit inside of this line and the trunk falls on the opposite side of the line. So go ahead and stand up if you're at home. We're going to try this out so that you can see how changing the trunk position impacts the knee. Let me bring this down a little bit more. So if you're doing a squat just on one leg, and all of a sudden you bring your shoulders way over to the side and reach, you can see what's happening at the knee as it's diving in, and that's going to create that dynamic valgus that puts more stress on the ACL. So say you're landing from a header and you're coming down, working on those mechanics so that we're not automatically losing the trunk control and going into that stressful situation can help decrease some of that stress there. All right, go ahead and have a seat. We'll get our things lined back up here. All right, so that's our example of how even core strength is important for us to address, and looking at the mechanics of the trunk can help with taking stress off the knee. Next, also looking at the muscles at the hips. So not forgetting that ACL connects up to the femur, which is the thigh bone, and that thigh bone is coming from the hip. So the hip muscles have a really big impact on your mechanics too, and creating that valgus position. So if you have weakness in the hips, the knee will dive inward, and that creates that dynamic valgus. And valgus itself is not necessarily a bad thing, but it's when it's uncontrolled, it's unstable, and there's not enough muscle strength to slow that movement down. And that's when you get too much stress on that ligament. All right, so then we want to ask ourselves, why is there a higher rate of injury among adolescent females versus males versus later in the age range as well? Part of it, you've got these local anatomical factors looking right at the knee itself. We've got growth spurts happening. A lot of times it takes time for the muscles and even the thickness of that ligament itself to catch up. So we talked about collagen and how the ACL is made up of collagen. What they found is when they take studies of kind of 10-year-olds, 13-year-olds, and 15 going on 16-year-olds, is that thickness of the ACL hasn't caught up to that growth. It's actually thinner and not as strong in these populations as you're going through that growth spurt. And then also there's a lot of decreased hamstring strength. Again, as you're growing, it's like if we're not really strengthening those muscles, they're not keeping up with the growth spurt. And then there's also an increased quad strength versus the ACL thickness. So that quad is able to pull on the tibia a lot more versus what the ACL and the hamstrings are able to resist. Next, looking more remote, a little bit away from the knee, looking at the pelvis itself. Females start to get wider pelvises at this age, and we call it the Q angle, is the angle between the pelvis and the femur. And the wider that angle is, the more likely you are to get that dynamic knee valgus position, especially if we don't have good muscular control at the hips. So also the movement patterns, you can see in this picture on the right that she's going into this dynamic knee valgus position. And that's something that's good because it's something that we can modify. It's something that we can work on. Some of the other factors we can't, hormones, growth spurts, but we can work on your strength, work on your movement patterns so that that's not as impactful of a factor in creating this type of injury. Then in terms of hormonal factors, we know that during particular parts of the menstrual cycle, there are higher levels of estrogen, and that estrogen actually diminishes the strength of the collagen that makes up the ACL. So that's why we look at okay, there are certain times that seem to be a little bit more prevalent for females to have these injuries. And that's when we have those higher estrogen levels that impact the collagen. Also, when we start comparing with males, we look at, okay, there's less testosterone. And we can see in this graph below here that when we start getting past that 10-year-old mark, there's a big difference in how much testosterone is present in males and females. And that testosterone actually helps to build up muscle bulk and hence strength. So when we're missing that as females, we got to really make sure we're working to develop that strength and that muscle bulk. Next, when we're talking about ACL injury prevention, there are multiple factors that we want to look at. Right? You can be strong, but still have poor mechanics that are still putting too much stress on the knee. When it comes to balance and stability, we're looking at, okay, what's the stability at the hip? What's the stability at the core? What's the stability at the knee itself? And then we want to start slowly introducing plyometric activities that are more that hopping, jumping, cutting, because that's what you're actually going to need to do in a game, in practice, which is where you tend to have those injuries. Also, when it comes to sport-specific training, we know that a lot of injuries either happen kind of early on in the game when you're not necessarily warmed up well, or happen later in the game when you're completely fatigued. So we want to make sure that we're looking at creating those correct mechanics in both of those scenarios, which means not just coming in, warming up a little bit, and then practicing your mechanics, but really fatiguing those muscles. And then once you're fatigued, practicing and making sure that those mechanics still look good, even when you're tired. In terms of Also controlling the knee. Things are a little bit different timing wise of these types of trainings. If you haven't had an injury versus if you've had an ACL reconstruction, you're coming back from surgery. So we really look at when we're doing rehab, the timing of how that graft is healing, because there are certain points where, you know, about 6 weeks out, you're starting to feel a lot better. Your range of motion is getting better. Your strength is getting better. But we don't want to stress that graft when it's in a vulnerable state and when it's trying to really remodel and heal. So we want to make sure the timing of when we apply each of these training components is happening at a place where we're not putting you at risk for re-tearing that ACL. So, and a lot of times, you know, people, oh, I'm going to go back to sport really early. I'm feeling really good. It's like, well, let's give it a little bit more time because we need to make sure that that ACL is really healed well before we're asking your body to control these more dynamic movements. And then we also look at when we're training you for handling those knee valgus positions, those tibial internal rotation positions. We want to train you for those, but we want to do it in a very safe manner. So a lot of times we'll add particular reaches and directions of movement that will start gradually putting stress on that graft at a time when it's safe to do so. And so we really like to manage how we're changing those angles and making sure that we're keeping you very safe as we're getting back to sport. And then also looking at if you've had, oftentimes when you tear the ACL, how much force is applied, what the direction of that movement is. You can also end up tearing your meniscus or your MCL ligament. And so when we're rehabbing you, we want to make sure how were these things repaired, what do they look like after surgery, and making sure that we're keeping all of these structures in the knee safe while we're training. All right, so we're going to take questions in just a second. I just wanted to reiterate kind of why we're here and making sure that we're really doing this for you guys to make sure that, you know, if we can prevent an ACL injury or help you rehab so that you don't have a re-tear, that's our goal. And so being, you know, having been an athlete and been injured and been on the sidelines, I always felt horrible because my team is out there trying to do something without me and I'm here injured. And so if we can prevent some of these injuries so that you don't have to feel that way, you don't have to be out of the sport that you love, and especially if you're looking at coming up to college and scholarships, you know, we don't want to risk those things because of an injury that we can really work on using correct mechanics, using good strength to lower those injury rates and prevent that. And I know coaches and parents, to see your loved one on the sideline not being able to do what they love can be heartbreaking. And so, you know, I'm glad that we've got some parents and some club directors tuning in because they're really also holding the reins on getting everyone the help that they need. So we're also putting together some risk assessment workshops where you come in, we look at the strength, we look at the mechanics and these things. And so if you're interested in that, please reach out to us. Don't hesitate. If you're in a club, reach out to your club directors and we'll see if we can get something set up with them. Because again, we're here to make sure you don't have to go through this type of injury. And if you've already gone through it, we want to make sure you don't have to go through it again, because we don't want you spending 6 months, a whole year away from being active and being able to participate in the things that really keep you going, that you love to do. All right, so at this time, we'll open up the floor for questions. Feel free to type in the chat box if you've got something that you want to ask. We can also unmute kind of one at a time, and we'll make sure we get your questions answered. We got one. All right. And do you want to read it to me, or we can? Got it. What is a good way to determine an optimal quad hamstring ratio? And what was the last part of that? And what's an optimal ratio for these patients? So if we were to get really specific, someone would get on an isokinetic machine and test just pushing and see how strong their quad is there, and test just pushing and pulling with the hamstring and seeing how strong their hamstring is there. And you want to have a fairly even ratio with those. But we also like to look at what's going on functionally, because the isokinetic testing, while it gives you information in like, oh, I have a straight number, that's not really what your knee is doing in real function. So it's a lot more about looking at those mechanics themselves and testing, okay, if I look at an exercise that's very hamstring based, how do you perform? If I challenge the hamstring more by adding a load, how does that hamstring handle that load? And what's the stability look like and the kind of consequence of that movement? So it's nice to have the information and to work on an even ratio. But again, we want to make sure that your mechanics are really the thing that we're working on. And when they've done injury prevention programs, they found that when they start focusing not just on strength, but really on mechanics, that's when you get a better result for your injury prevention. So yes, the strength is important, but the mechanics are equally as important, if not more important, because that's really what you're doing when you're out on the field. So the question is, do we have any specific exercise recommendations for posterior chain strengthening for a female adolescent athlete? And again, a lot of it, the strengthening is good, but we got to make sure we're bundling it with the mechanics as well. So even a lot of times doing like a single leg RDL, reaching in multiple directions, not just reaching straight forward, can be good to start really strengthening the hamstrings. And again, the good thing about reaching in the multiple directions, that's one thing we often forget when we're doing strengthening workouts, is that hamstring shouldn't just be taught to go straight forward and straight back, because that's not what happens in real life. You're going to be pivoting, you're going to be moving in different directions. So make sure that you're not just going straight forward, you're going a little bit to the sides. Also, even looking at certain step up exercises, but looking at how are we actually loading the posterior chain as we're doing them. A lot of times we'll look at these common exercises like step ups, and we'll see people doing them in a way that's very quad dominant. So making sure that the mechanics are right with those, for example, kind of leaning the trunk forward a little bit more to lengthen the hamstring, lengthen out the glute before you step up, will create more of that posterior chain activation. So there are two, but there are many, many that you want to go through and look at gradually loading and gradually also making those movements more dynamic and specific to cutting, specific to how you're landing. But you want to do all of these things in a stepwise progression so that we're not jumping ahead to something you're not ready for. Yes, let me pull up my picture for a little bit more explanation on this. I have to click through this one a little bit more. So when we look at kind of physics-wise, how do you activate more one muscle than the other? So say we're looking at the squat here, and the trunk is very upright, and the knees are very far forward. So what these mechanics do is we look at where you're making contact on the ground and where your center of pressure is. And then we draw a line going up more toward where the center of mass is. So basically looking right below the belly button back a little bit. So when we look at this line, it's very far away from the knee. And that's how, when we look at how long is what's called the moment arm, when we're talking in terms of physics, and when the knee is very far forward and this is a very long reach, that is going to put a lot of stress on the knee and activate the quads. Versus you see this line is not very far away from the hips. Because that line is not very far away, there's not a lot of load and demand on the glutes and the hamstrings. So when we change the mechanics and we have this person lean forward more, that brings this line forward closer to the knee. And again, because that line from this vector toward the knee is smaller, that means you're going to get less quad activation, less demand on the knee. And because this line is farther away from the hips, you're going to get, oops, I clicked on it. There we go. Because the line is farther away from the hips, that means that there's going to be more load on the glutes and the posterior muscles here that support the hip. So that's how one example of how just changing how you're doing a movement recruits more hamstring or more quad. And we want to make sure that we're definitely training those posterior chain muscles, the hamstrings and the glutes, to handle that load versus just asking the quad to do the work. All right, any other? Yep. Okay, the animated videos. So if you go on YouTube, the question is, can we review the animated videos and where to find them? Let me go back to sharing the videos on my screen.
Connie, if you actually want to throw the link into the chat, that would probably be.
Okay, perfect. I will put that link into the chat. Hold on, I gotta get the right screen here. All right, so I'll throw both of these links in at the bottom. These were put together by a group that I worked with during my residency. Let me go. All right, so we'll throw both of these links up in the chat for you guys so you have them. I'll go ahead and play it again so we can review them while I do that here too. So let me start back here.
Works. The anterior cruciate ligament, or ACL, is an important structure found deep within the knee joint. As we see here, the ACL is a ligament that connects two bones, the thigh bone, or femur, and the shin bone, or tibia. The ACL is made primarily of type 1 collagen, a substance that is found in soft tissues and bones throughout the body. And even though it looks small, it can withstand forces of up to 500 pounds. The ACL's main function is to provide the knee with stability. It does this in two ways. First, it helps keep the tibia from moving too far forward on the femur, or over-translating. Second, it keeps the knee stable during rotation. Think of it kind of like the cables on a suspension bridge. It connects the thigh and shin bones, helping to keep them in place and provide support for the knee in moments of stress. There are two distinct bundles that make up the ACL, the anteromedial and the posterolateral. Each gets its name from where it inserts on the tibial surface, here and here. Together, these two bundles help provide stability for the knee throughout its complete range of motion. To be specific, the posterolateral bundle is more protective when the knee is extended, like this. And as you might have guessed, the anteromedial bundle is tighter when the knee flexes, like this. For more specifics on ACL function during athletic activity, check out our video with pro soccer player Stuart Holden.
All right, and then I'll play this one and get you guys the link to this other video. Copy the link for this one, and we'll put that in the chat as well.
Otherwise, you already know that it helps to stabilize the knee in both forward and backward translation and rotation. Here's how the ACL functions when you run. When your leg is on the ground and you're bearing weight, the tibia moves forward on the femur, then returns back to neutral when your leg is off the ground. An intact ACL will help keep the forward shift of the tibia in check during your stride. When your ACL is injured, the tibia will move too far forward, which puts stress on the secondary stabilizers of the knee. When you're cutting or pivoting, you're often planting your lead foot hard on the ground, stopping abruptly, and then propelling yourself in another direction. When you plant your foot, three large forces are introduced on your ACL. These are internal rotation, dynamic valgus, and anterior translation. If your muscles are weak or your technique is poor, these same forces can cause an ACL injury. When training, focus on building strength in your core and leg muscles and developing a sound sense of body control. Check out our video on ACL injury prevention to learn some.
All right, so those are those videos again, and we got the links to those. I know they are constantly making new videos in there too. And the videos are just a nice way to really visualize what's going on with those. Yeah, I think I saw a couple other questions that were sent. All right, so the question is about, since injuries happen commonly either early on in the game or when fatigued, what are some specific stretches or warm-up techniques you recommend to reduce this risk? A lot of times we're looking at more dynamic type stretching. A lot of times we'll see static stretching where we're just holding positions, but actually moving in and out of those positions can be good to get those muscles warmed up a little bit more. And then also working on some more dynamic, like squatting, single leg squats, and working on just kind of warming up with reaching in different directions. That way you're prepared to handle that little bit of valgus stress when it comes, and it's not a novel thing to you that day when you're getting there. And then when you're fatigued, make sure that you just are training under those scenarios. When you're already fatigued, you're watching your mechanics and starting to train that so that when you do get fatigued later on in the game, you're used to resisting that. I've got a couple in the chat that were just sent to me, so let me go through those two. Do we have any videos on the rotator cuff? I'm pretty sure they're always trying to put out more videos and more education from that group. So if you look on their channel, you'll probably be able to find some on the rotator cuff. And then when is a good time to start implementing strength and mechanics training? Is it teenage years? Is it earlier? And then kind of what is the difference about the rehab at Rehab United compared to others? So it's good to start implementing that strength training before you hit this window where your injury risk is increasing. So even if you can start a little bit before the teenage years, even going 10, 11, 12 years old and starting to work on those mechanics, because when you get into that 12, 13 years old, that's when the injury risk is going to start going up. So you want to definitely be a little proactive on that end and get some training earlier rather than later. And then what is different about rehab here versus others? I can't necessarily speak to what other clinics are doing. Sometimes we get people who come in from other clinics and they've been sitting on a table just extending their knee, trying to strengthen their quad, or just bending their knee, trying to strengthen their hamstring. And again, while that strength is important, it's really important that we're working on the mechanics as well, because even if you have strong muscles, but you haven't been trained how to use them functionally, standing, squatting, doing a more active program that's more dynamic, then that strength won't necessarily translate over into a game situation where you're moving and cutting and running quickly. All right, any other questions?
Can you go through just a progression of like loading, so like the squat from double in to single foot progression, so you get to various motions of challenge.
Got it. So we'll go through a little example of kind of what even a squat progression would look like. So you guys think the standard double leg squat where you're going down, let me back it up a little bit more so you can see me better. So when we look at a double leg squat, we've got pretty equal weight on one side versus the other. And we can even change the reach too, just to protect more one side of the knee or the other. So you'll see as I reach this way, if we're looking at my right knee, I'm going to go a little bit more into that valgus position. Whereas if I'm reaching with my left hand, it's a little more in this the opposite direction, which is varus. So we may start even with a reach here and then gradually work toward the center and then gradually work to the other side. And here it's fairly safe because you've got both legs really working and helping you. And this is a good place to start practicing if you've had an injury on one side, that you're not leaning way far away from it, that we're actually getting you pretty even. Then when we're ready to progress that, we want to start adding a little bit more weight. We may go single leg toe touch, where now this left leg has less weight on it. And so we're really focusing on putting a little more weight on this one. And again, those reaches can still be used. We may want to reach over here if we want to keep it very safe in the beginning. And then we want to start gradually challenging you to go slightly further and to control that knee valgus and come back out of it very safely. So then to progress this, we may put the foot up on the box or go single leg. And again, you can also vary the speed of this. We may start slow so that you can really focus on how you're moving. And then we may start making it a little bit faster. Then you can also start adding in some hopping, going down, add a little hop and land. And again, we might add a reach here to be very safe as we're starting this exercise, but then progress it to adding a reach more in this direction to really learn how to control that valgus. Then as you're progressing, we also want to be very sport specific. So if you have something like, oh, I've landed, I did a header and now I'm coming down, we may have to start training you a little bit more upright after we've really loaded these posterior muscles and made sure that they're strong and that you're able to control those mechanics. So we look at how can we add helpers with the reaches, and then how can we gradually take them away. All right. I don't think we have any other questions, but feel free to reach out to us. Again, my name is Connie. I'm a physical therapist here at Rehab United. We've got other great physical therapists on staff too, and we're here to help you. So if you have any questions, feel free to reach out. I'll make sure that that my email is in here too. I'll go ahead and type it into the chat so that you have it. If you have any questions, feel free to email me. We've also, you can go check out more information on our website if you want to know more about us. We thank you guys for tuning in. And if you need anything, we are here for you, all right? Hope everybody has a great holiday.